clear that when it comes to the access, like you're saying, no one should be barred from accessing. Obviously, trying to also respect that when it comes to even the issues of the risks that are there, because me and you, especially, even if you are a healthcare worker, just from seeing someone walk into the facility, you can't diagnose from the eye. Exactly. So even if you could say that, no, these people have got, they understand, and exactly, you can't just from the naked eye. So the department has taken a bold stance on that and has been communicating widely. So I think it's also a good thing that you are raising to say, these are the influencers in terms of access currently.
Yes.
Worse off that even amongst the responses and the media statements from the department was that sometimes even a South African doesn't have documentation.
Yes.
So you can't say as to who is and who is not. Yeah. But I'm sure there's other issues. I think you had mentioned, or we were saying that there's also these other government entities that are there to, I don't want to say watchdogs, but they have been there to empower. Yes. I think that's the most progressive word we can look into, that they can empower citizens to understand how exactly the issues of access to care is about.
Yes.
Let's reflect on that. I do note that my province of origin, Eastern Cape, this week was also having a visit from one of those entities in the form of the Human Rights Commission.
Yes.
And when I say Eastern Cape as a province, I mean the Department of Health.
Yes.
They were having a session that the Human Rights Commission has been having issues around one of the facilities and the complaints thereof. And in the main, it was issues that relate to access as well. So those are the entities that I think you might also have worked with or have come across. And I'm sure you can share a thing or two in terms of both what has been coming up, but also how to empower our people to say, how are they part of correcting, if we can use that word?
I'll give, I'll give an example of something. Okay, maybe let me also say to the viewers that I originally come